This is Healthcare Now Radio's Talking the Walk. Come along with us as host Tom Testa and his guests discuss the strides being made toward actionable changes in the industry. It's a fast-paced 30 minutes, so keep up. And now, here's Tom Testa.
Hello, everyone, and welcome to Talking the Walk. I'm your host, Tom Testa. This show is all about diving into real conversations that inspire, challenge, and move us forward. No shortcuts, just authentic journeys. Joining me today is Kel Pults, who serves as Chief Clinical Officer and VP of Government Strategy for MediQuant. They are a leading provider of enterprise data archive solutions that is transforming the way hospitals and health systems engage with their legacy data. The company's flagship product, DataArc, allows health systems to maintain access to relevant clinical, financial, and administrative data, ensuring that valuable data required for patient care and compliance is within reach. Kel, welcome to Talking the Walk.
Thank you for having me. Good morning.
Good morning. Now, Kel, I've had the pleasure of having many conversations with you, about a handful of conversations over the last year or two. But I'd love for you to give our audience a little bit about your background. It's a pretty rich background. I know that you also have served on the clinical side, as well as what you've done leading up to your role in MediQuant. Can you tell us a little bit about your journey?
Sure. Well, I've been in healthcare for about 27 years. Background originally as a nurse and doing patient care at the bedside. So pretty much everything except OB in there. And then I had the opportunity to come off the floor and work with our IT department implementing an EHR. So that was my first foray really into getting to the IT side. Original documentation years were on paper. So I was also moving to electronic at that time. And once we implemented the software at our hospital, I went to work for Siemens Medical at the time, who was later bought out by Cerner, who was later bought out, by Oracle. That process goes over the years. But moving to that, from that paper to the electronic medical record and just how you do things, the transition, I really saw a huge gap at the time between how providers saw electronic documentation working with IT and how IT worked with providers. There was a big gap in understanding between the two of those. And so I was fortunate enough to kind of get in on that during that space where everything was moving to transition, meaningful use. No one even knew what it meant. We had to get some descriptions about that. And then over the years, just really got into the informatics component of this. So project management, implementation, software, working with beta sites, that type of thing. And I've just been fortunate enough to be put in positions where I've had the ability to learn some broad experience and get broad experience in those different areas, from the clinical side all the way through where we're talking about cyber stuff right now and security, privacy. I'm a privacy officer as well. So I think, having the informatics component really assists in my job now, because I don't think there is such a divide between where we are on the clinical and where we are on the IT side. We see clinicians working as part of the IT team, as part of product now. Everything's really embedded, and it is a collaborative effort to move us forward. So there's been a huge transition in that over the last 10 years.
That's great. Yeah, no, and it's great to see that you've been part of the clinical side as well as the administrative side. You've kind of seen some of the headaches that have happened too. I'm sure there were plenty, and unfortunately, even as an RN, right, you saw many of them, and now you're helping kind of deal with those headaches.
It's interesting to archive things, and that in that archive information is your own documentation.
Mm-hmm. Right.
From working in hospitals that we at MediQuant have now archived some of that data, and I'm thinking they've got my documentation sitting in there somewhere, or my patient data, as we work on the government side now. Doing legacy stuff. My husband was military, my son was military. So somewhere in the things that we're archiving off are my actual medical records too. So,
right.
You see things really come around full circle when you're in this kind of role. So it's been an interesting journey for sure.
Excellent. Well, thank you for that background. Appreciate that. Well, let's dive into our conversation, get to the heart of things here. As the calendar turned to 2025, we're definitely expecting some new regulations and legislation throughout healthcare. What do you see as the most significant pieces of policy poised to impact the industry? And I've kind of got a part B to that question too. How should healthcare organizations prepare for these changes?
Well, that's a great question. I think that there's certainly going to be more than one topic of things to address this year. We have a new administration coming in. We've got new people who affect healthcare, and I think that there's been some very vocal conversations and some things that have been said over even just the last few months that are going to create some impacts for healthcare. Just trying to get America healthy again. And I think some changes to how that'll affect education, what we give to our kids, even in the lunchroom, what's going to be allowed in our foods. All of these types of things are going to affect healthcare in general. Could, hopefully in a good way, right? We're hoping that everyone's going to eat healthy because there's a lot of things out there that is not really transparent for people what they actually are eating. And this is, of course, the nurse side of me coming out. I
Mhm.
probably have, just like everybody else, I have no problem running to get a hamburger or something like that. But there's also that knowledge, or I should say lack of knowledge about what's really, in our food and what we're actually eating. And I've started doing a lot more of that reading myself. But that will affect healthcare. There are policies around reimbursement that are going to be coming out. There are policies around cyber security, privacy, access to records, all of those things, policies that are starting or have started, being in place right now that are going to carry through, and then not knowing exactly what some of the changes are going to bring to some of those policies. But I do think there are really good ones out there that we're going to help, hopefully are going to help improve our health. And as from a patient perspective, give us access to the records faster, more access to the records that we've not necessarily access to. At the same time, they're trying to protect the data. So I expect there's going to be a lot of policy out on how to better secure the data. I was reading an article actually just this morning, and ONC is reporting that they have, which falls under the Department of Health and Human Services, an increase of 246% in large data breaches since 2018. That's a huge
Wow.
statistic, right? And it's a lot of it has to do with the vulnerabilities in whether it's the EHR itself, whether it's in the organization. Still, they're pointing out, even though there are hackers, malicious software, but the malicious software that's actually what ransomware is. It's a malware, introducing malware into something. Most of those happen from vulnerabilities with the employees or the people that are accessing those systems, inadvertently clicking on something. And so I do see a significant change in training and requirements around more tracking of what training people are actually getting, especially when you're dealing with PII or PHI.
Mhm.
I know our organization, for example, we have significant training, quarterly, annual training. Um, and we've really, I'm going to not even say double down, but we really quadruple down, moving that quarterly training plus annual training, sending things out daily in emails, sending out just phishing things, emails to employees, trying to train people's mind to think differently when they look at something. Is, don't just automatically click on a link. Don't believe everything you send. We're going to shut down your account here if you don't click on this. I don't know about you, but I get a ton of those things in email sometimes. We need to validate your account. You're
Right.
going to get paid. All these crazy things come up. And I think it's making people aware, not just employees, but I think general public aware of all of these things. And it's going to take a large effort, and everybody, even a layperson, getting some of that education out there to help protect them and protect systems. Because if you've infected your system, you're logging in somewhere else, you click on a link, you don't even know you have it until all of a sudden, it's typically what they say is all of a sudden something comes up and says, we have locked your data. We've encrypted your data.
Right.
So federal regulations around that. There's an executive order that's being discussed right now just around how you handle some of those things and requiring extra security in software itself to be embedded in the software to kind of protect for anyone that's going to be working on the federal side, which is something that we do, is working on the federal side of
Hmm.
fighting space.
What about AI? You talk about regulations, and because to me, AI and cyber tie in together. To me,
Yeah.
and it's just giving me, not to be the pessimist. I'm scared, a little scared about it. Like, how do we control it? How do we make it secure? Do you sense there's going to be some regulations moving forward? There was talk about it last year. Are we going to see something in the year ahead?
I think we're going to have to. I think right now it's sort of been an open field. I just, we've already got incidences where you've got cyber criminals using AI as part of their hacking scheme, right? So you've got countermeasures where people are using AI to kind of counter some of those AI generated or AI hacking schemes that are coming in there. We were just talking this morning in a meeting how realistic that there's actually this happened to a company being on like a meeting, like a Teams meeting or a Zoom meeting, and you've got a group of people, and one of them was an AI, and nobody knew that it wasn't the real person having a conversation and going through. And so what you see, what you hear, if you do anything with social media right now, you can't believe everything you see or read. I mean, you shouldn't have before, but now it's even 10 times, more
Right.
questionable. Is this an AI generated type thing? And there's not been a lot of regulation around it. I think that to get a handle on some of that, they're going to have to put some sort of regulation to control it. Things are just getting so realistic right now. And you're right. I'm a little nervous myself, determining, do we believe this or do we not believe this? It used to just be, well, we weren't even sure if the media was putting out, but with AI engaged in it now, they're coming up with their own stories.
Right. Right.
AI's, being able to just come up and think about next steps and think about coming up with all these things. It's learning these types of activities. And I think it makes everybody vulnerable. You used to be able to get the picture, and they're still doing it in some cases where you bring up to prove that you're a human, where you
Right. Right.
select, they've figured those out. Show us all the pictures of a bicycle. They've been trained to pick the ones that are bicycles now. That is not going to be effective anymore to determine or prove that you're a human. I think those types of things are going to be harder, especially when we want, multi-factor authentication to come in.
Right.
We're going to have to figure out what are things that an AI cannot and will never be able to duplicate. Are we going to be able to come up with some of those things to protect us? Because one of those multi-factor authentication was that visual where a person had to select them, and now AI can get through that.
Right. And it's too bad because it's instances like that make people fearful of AI, but there are a lot of great uses for it, especially in the medical field. I mean, I
Yeah.
know that if I, even as simple as I, went for an X-ray a couple months ago, and I know it was AI that read the results of my,
Yeah.
so it's tough. It's a catch-22, I think, for a lot of folks like me, who's just on the outside saying, geez, how is this going to impact things like my healthcare?
Yeah, exactly. And to your point, um, being able to use AI to read something faster, to be able to point these things out where you don't have to have a person sit for an hour, 2 hours of time. You have an AI that can go through it and say, look at these anomalies in particular. That's where AI is very beneficial when it comes to healthcare. I think where we have to figure out is where's that balance? Where's the balance where it gets too scary and we don't, we lose sight of the fact that you need to have a human present in there to make some of these decisions. And I think that's probably 2025. I expect we're going to have to get some regulation around where it's going to be allowed and where it's not going to be allowed. Where do we draw a line? Is it going to get to a point, and this has been a concern for a lot of years for people that really know how these things work, is it going to get to a point where they can think, or they can process these things more like a human brain can, and they stop, they pull out the provider out of certain pieces of it, or they can start thinking on their own. And then we have computer programs that know how to hack, and this is just what they do without somebody actually putting them up, putting it in there, having too much influence in it. I just think we've got to figure out where that is. And I do think it's not just a fear. It's not, of a group or one person. I think the more we see, and I've seen more in the last 6 months than ever, this learning on social media. I've just seen it everywhere. Like you look at it and say, gosh, is that real or is that not real? I can't tell anymore. And that is a concern. I think it's becoming a global concern.
If you're just tuning in, you're listening to Talking the Walk on Healthcare Now Radio. I'm Tom Testa, and joining me today is Kel Pults of MediQuant. Kel, this has been a great conversation. And before we dig a little deeper on the cyber front, I want to get back to talking about some of those regulations. Do you see any challenges? We talked about cyber, we talked about AI, we talked about general health stuff. What are some of the challenges or potentially opportunities that might arise as a result of these pending regulations and policies?
Well, I certainly think there's opportunities for more companies out there to, especially if they come up with a regulation where they want to add cyber type activity in software. There's going to need to be somebody that actually probably develops that type of activity. So I think there's some development opportunities here, which are great,
Mhm.
to kind of put in there. And this, I think what would be beneficial is to have more people at the table. Right now, for example, there are a limited number of big players that are at the table for some of the discussions, and there are very few smaller companies that get brought to the table. So, for example, we have standards that are coming out, or that they've been working on for some time around fire. This is the interoperability space. I expect that that's going to continue to grow and to evolve over the next couple of years. But we've got a lot of big players out there that are participating in this, and I think that to really get adoption in this, they need to bring in smaller players. There's a lot of companies out there, a lot of people that have a ton of great ideas that
Mhm.
I don't think are getting brought to the table. That the standard big players are involved. They're making some of these big decisions. Obviously, they have a lot of money, so they get to participate in a lot of these things. But I do think that for us to really get adoption across the industry, you're going to need to bring in more people. That's one thing, is people that participate tend to promote the adoption of it, especially if they've had a little bit of say in something. It's kind of change management, really one-on-one when you're implementing any kind of change, especially at this scale. Look at just an organization putting in a new EHR. You involve people in
Right.
that change, you get adoption of what's going on with it. You exclude people out of the change and you get pushback and you don't get the adoption that you need. And really, this is one giant change management process, moving people to a new state of interoperability, a new state of mindset on how we talk to each other and collaborate on how to actually protect the data that they're trying to be interoperable with.
Well, I want to kind of dig a little deeper on the cyber question because I believe and talk really change healthcare. So
Okay.
the I think February is when it happened last year. We're approaching that year mark of the change breach incident. I think anyone who's anyone in the industry knows it impacted everyone, and including
Yeah.
patients, providers, everyone here, payers. What have we learned since then? What have there been any significant changes, or maybe there haven't been, in how organizations are addressing security vulnerabilities to patient data?
Well, I think one thing that came out of that is, if you think you're secure, you're wrong.
Mm,
If you think you're 100% secure, I think that absolutely changed the mindset. They've been saying for years, it can't happen to me until it does. There's not anyone that's 100% safe right now. And so what you do is you put in the safeguards. Again, it's not just the technology piece of it, but it is the change in mindset, that you have to change a culture's mindset of what is safe. Don't click on this, don't click on that. Make sure you're tracking who's accessing records in particular. But I think in 2025, one of the things that the government is looking at, and it right now is being talked about as executive order before change happens. I'm talking in the next few days, this
right.
could potentially come out, is changing how, people, the requirements, I guess, for cybersecurity, how you deal with third parties, how you track who has access to these systems, because it's a great idea. We want our patients to be able to have access to their records, whether they get access through their patient portal or whether they're asking somebody else to get it. We want them to have that access and be transparent with providers back and forth, the interoperability components. At the same time, having a requirement to make sure that you've got a backup,
Mm,
something that, and this executive order is talking about 100% backup of the data. So, really constantly moving a backup copy of this, because that's what happened really with change. Is you have disaster recovery, which doesn't always, it's not a complete backup all the time. It's, if there's changes to it, they'll keep it. This is a standard, backup process.
mm,
You have disaster recovery that's typically at a different location. But what happens when somebody has ransomware, the malware incident, and then your data is held ransom and they lock it down, is, do you have another copy offline somewhere that you can bring up, that you can move all your people over to this environment, run your system, and you're not losing your patient data? Because that's really what it is it's the data. And they
mm.
figured out that it doesn't matter if you pay the ransom or not, you don't get the data all back. I don't think there's been a single one where they're getting it all back, where we're going to hold your data captive until, so they either don't get it back, they paid a ransom, They don't pay a ransom and don't get it back anyway, or they pay the ransom and they get partial pieces of it back. And by then it's already sold out anyway. So your goal, if you have one of these incidents, is to be able to take care of your patients, still do your day to day, bring up another, the other environment that's an identical copy or that will allow you to care for your patients, handle the cybersecurity incident or the ransomware incident, whatever's going on over here, separate, but you continue to do your patient care. And I think that was a big lesson, I think, for several of the ransomware incidents, is not just the Change Healthcare, but what it did to patient care, how it prevented people from getting to the data, how, ultimately in the end, the ones that end up paying and suffering are the patients who,
Right.
the providers can't access data, that kind of thing. So I do expect either the executive order that they're talking about signing in the next few days will have some words about that, or, even in the incoming administration, I think there's things that they agree on. I think that patient safety and that healthcare and the security of the data is probably consistent across the board.
And do you think that's something that's going to be easily adopted across industry wide? And how
Well,
fast?
I think it's going to be easier for some than others, Tom. And part of that's financial, right? It's just a
Right.
financial
Right.
exercise. Some hospitals do much better financially than others. I mean, even when everyone is moving to meaningful use, we saw that one of the biggest barriers to being able to get to that was the financial aspect. Of course, the government had carrot stick thing going on. We'll give you this money to get you up and running. And then, it got to the point where, but you get to this point, you don't have, we're going to start penalizing you. With these new interoperability regulations, cybersecurity regulations, I haven't seen any type of incentive or any funding that might be available to people that don't have the funding to do this. So what it pushes people to, that I can see it pushes people to, and we've seen it for a few years, is if they don't have the financial ability to do some of this stuff, they sell. So we see a lot of merger and acquisition activity going on, hospitals closing, they can't afford both. But if you've got specific cybersecurity requirements it's not optional, it's going to be a requirement. Now, there's a difference between you should and you have to, right? If you have to get this, and you're going to have to focus and prioritize your budget to focus on cybersecurity, and keeping these things safe, which means where are you moving that money from, especially if there's no funding to assist with anything like that. And I've not seen any proposals yet that there's going to be funding available for this. So I expect that, just as a domino effect, more merger and acquisition activity is going to probably happen out there. There's going to be staff cuts. There have already been staff cuts to change priorities. And in some instances, we've already seen the effects of staff shortages, not necessarily all because people are leaving the healthcare field, but people are retiring. The baby boomers was a huge, huge group of our workforce. As they move into retirement, there's not as many people. They have a different idea. People don't stay in a position for 20, 30 years like they used to. They can change their profession every couple of years, and then they're out of the health. What we've seen is closed wings of hospitals. We've seen the increased merger and activity, our acquisition activity going on. We've seen OB departments closing at hospitals. Even where I'm at, where we everything here is volunteer, like on the volunteer fire department and EMT on our ambulance. We have to go pretty far to find a hospital now that has not closed their OB wing. If it's an emergent delivery, we can take them and everybody can, in the ER will do it, but they don't have an OB wing anymore. They'll stabilize them and move them out. And, that's happening all over the country. That's happening all over. So they're prioritizing what their services are going to be too.
Wow.
So increase in telehealth. I mean, you talked about regulation, staff shortages, increase in telehealth, increase in or reduction in services at hospitals. They're having to pick and choose where they're spending their money. But every organization is having to divert some of their funds from their, into security, privacy, to trying to protect the data just to meet requirements for that. So it'll be interesting, how they make this happen over the next couple of years.
Absolutely. And the Change Healthcare, I mean, the incident wasn't a wake-up call for the industry, because it's been
Yeah.
targeted. The industry is, and what's tough too is, you talked about early on in our conversation about educating staff and training staff. how can we prevent the next Change Healthcare, right? Through the trainings and education. But my goodness, like the attacks are changing themselves. They've become more. I don't even. There are terms about the certain new attacks I've never even heard of in my life, and I'm like, my goodness. So it's not that it's sure it sounds like an uphill battle, but it seems like there's maybe not as much has changed since last February, given the Change Healthcare, but the industry's trying to get there. I think
Well, it's
everyone's.
exposed, right? I think what it did, Tom, is it's exposed vulnerability
Mm,
and I think that what the mindset of it's always just these small companies that it happens to, and they just don't have this and they didn't have that in place. This was a huge, to your point, this was a huge wake-up call that, hey, this happens to the big guys too. And they weren't just in a few facilities, they were all over the
right.
place. It was a big old footprint of where they were located that was affected by this. It wasn't just, oh, this one vulnerability affected this one hospital or these three hospitals. This one, I don't even think that this probably news just stayed in the US. This was something that is going to be used globally for healthcare organizations across the globe about vulnerabilities, simply because they were so big. And, it became one of those, well, if it can happen to those guys, it could certainly happen to the rest of us. And it was very public, it was very broad.
Mhm.
And so it wasn't one of those things that we just, because they're happening every day, but you don't hear about all these little ones happening. And
Correct.
you get something like that, and it certainly gives a wake-up call to the whole industry, not just a state or a town or a particular system. It became a wake-up call for a country.
Wow. Well, Kel, there's so much more we can talk about. This conversation has flown by, and this is really all the time we have on today's show. Thank you so much, Kel, for joining me.
Well, thank you for having me, Tom. It was great talking to you.
Same here. If you'd like more information on MediQuant or are interested in connecting with Kel, visit their website at mediquant.com. Thanks for joining us today on Talking the Walk. Tune in to hear us weekdays at 8:30 a.m., 4:30 p.m., and 12:30 a.m. Eastern Time. You can also find all of our episodes on the Talking the Walk program page on healthcarenowradio.com. If you are someone who is walking the talk, we want to talk to you. Connect with me on LinkedIn or by filling out the show's contact form on healthcarenowradio.com. Until next time, keep walking your talk. I'm Tom Testa. Take care, everyone.